conservative dentistry and biomimetics they go hand in hand, but conservative dentistry falls for cosmetics, it falls for just day-to-day general dentistry. The number one kind of philosophy with that is you're trying to conserve as much of that tooth structure as you can while also getting the job done appropriately. So whether it's fillings, crowns, even, for teeth that you're ultimately deciding whether or not it makes sense to remove or put implants in, conservative dentistry applies to all of those because, there are some dentists who, if they see a compromised tooth, are more willing to remove that tooth versus a dentist who's got a more conservative approach where, if that tooth can survive and we can get good years out of it, it's worth saving. For just general day-to-day dentistry, like with crowns in particular, conservative dentistry is like the number one way we keep people away from root canals. And that is how you get patients to trust you and to keep coming back, is how many times have you been able to treat them and then the next day you call them and they tell you, I don't even feel like I did anything yesterday. That's essentially how you build a patient base. So conservative dentistry is step one is, how much tooth structure are you removing to get to your end result, whether it's a filling or a crown. Knowing how to essentially stop drilling is the number one factor there. So even with deep cavities, a lot of dentists aren't trained well enough to treat a deep cavity without causing a root canal because they don't know how to do it in a way where you're preserving, not only maximum tooth structure, but you're also treating that tooth well enough to preserve the vitality of it. So if you work on a tooth too quickly or if you remove too much, and it's very easy because you're working in millimeters, you can cause a patient to have post-op pain and distress almost immediately if you don't know like your endpoints. Basically, it's not only with deep cavities but with crowns. That's like the number one thing that we see with patients is when they have these big bulky metal crowns. It almost never looks natural. The gums look inflamed. The patient usually has pain. They usually need root canals either immediately or a few years later. So by doing conservative dentistry, you're doing things that mimic the person's actual tooth or what it used to look like. And you're doing it in a predictable way that's going to get them like kind of the best outcome for, hopefully 10 to 15, 20 years.